Yeah, we continue. Apparently, I don't know if it was network, but we were cut off, so we continue. Okay, so I'll continue. I'll share my screen again. All right, so I'm waiting for the screen to share. Let's wait for it. But we want to start talking about motility. Share, 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 share. Share is not here. Okay, so we'll just continue anyway. So motility. Now, motility refers to the direction of movement of sperm cells. It can be immotile, it means they are not moving at all. When they are progressive, it means they are correct, moving in the right direction, moving in a straightforward direction, going towards the egg. When they are not progressive, it means like they are moving in circles or moving in the wrong direction. These ones are not going towards the egg at all. Okay, so if we have motility that is greater than or equal to 40%, progressive, then we are happy. We know that this amount, as long as the count is normal, we are sure that these ones will, about 40% of them are progressive. We are sure that yes, pregnancy. Less than 40 we can manage, but anything below 32% is poor and be able to achieve pregnancy. That's what we worried about. Okay, so poor motility is called astenospermia. A little bit of a tongue twister there, but that's just what the medical term is. Now, causes of poor motility include the use now. So we want to say for people who are into maybe sports and people who are maybe not into sports but are interested in bodybuilding and use steroids to achieve that, that can backfire later and cause poor sperm cell motility. The access is varicocele as a condition can cause poor motility. So transport the sperm cells from the testes where they are produced to the glands where they are stored. Okay, that tube is the epididymis. Where we have swelling along the part of that tube is what we call varicocele. Where there are pockets of those swellings, there can be stasis, that is the flow of the sperm cells are not as they are supposed to be, and then eventually it causes them to lose motility. Use of illicit drugs again. There are some drugs we mentioned when we first of all describing the problems with motility, like your NSAIDs. We've talked about steroids, of course, chemotherapy, some BP drugs, some antibiotics can cause a slowing down of sperm cells. Infection is also implicated. Smoking, of course, warm testes again. These are all implicated in exposure to toxins, radiations, ingestion of processed food, soy, alcohol, fried food, smoking, overweight. All these cause poor sperm cell motility. How can we improve sperm cell motility? Factors that improve motility. Healthy diet, of course, we cannot overemphasize. Foods like beans, lean red meat, oysters, pumpkin seeds, these are rich in zinc. Zinc is an essential vitamin or mineral as it were, sorry, mineral, sperm motility. Dark chocolate, spinach, walnuts, asparagus, citrus fruits, avocado, oily fish like tuna, salmon, sardines, pomegranate, which is a fruit, whole grains, garlic, liver, that is beef liver now, tomatoes, garlic, all these contain essential minerals and vitamins like your selenium, your B, D, and E vitamins, your folate, your ubiquinol. All of them are essential for improving motility. The fruits that is called goji berries help to keep the temperature of the testes normal. Managing stress can help improve motility. Exercise, proper sleep, these are general factors that can help in. When we have our DNA of the cell, once the DNA is fragmented, it can no longer give instruction as to what the shape of the cell or the size of the cell or the structure of the cell should be. Once that happens, you have a differently shaped sperm cell. Okay? When we have morphology that is above 15%, with other parameters being normal, like your count is normal, your motility is good, we will not be worried, even if it is only 15% of the cells that have a good morphology. But lower than 50%, we will be worried. Abnormal morphology is called teratospermia, that is wrong, bad shape. All right, alcoholism and use of illicit drugs, poor sleep, lack of exercise. Then certain exposures in some occupations like plastic production or use of pesticide in the case of farmers or people that produce the pesticides themselves, exposure to metals like in the case of welders, of people who maybe work in communication industries where there is always radiation, or outrightly in radiotherapy centers. This can lead to abnormal morphology. High intake of refined sugar, fried foods, red meat can also contribute. Avoiding all these things can help. Now, factors that can improve sperm morphology: healthy lifestyle, healthy diet, all those things that were previously mentioned, exercise, maintaining stress, use of antioxidants in the case of supplements. These, again, for supplements, we don't want to mention them, just talk with your health is best for you. Okay, so the use of all these will do what? Help to improve sperm morphology, which is the shape, the structure, and the size of the cell. These make it to carry out the function that it is supposed to function, or to carry out rather. The next thing is cell viability. This refers to the cells that are alive, simple and short. How many of the cells are alive? High viability means that there are more cells alive than dead. Low viability means that there are more cells dead than alive. Okay? If we have viability of about 75%, we'll be happy. Like we said, the range is 54 to 97. But if you can get healthy, viable cells that are up to 75% of the cells, we will be happy. Causes of poor viability are the same for oligospermia, which is low sperm count as the same factors that will improve cell viability. So if you didn't get that, look at it again. If you are on our WhatsApp group, you will get these slides, this PowerPoint presentation, you will get them so that you can also go over them again and understand the factors better. The next factor or parameter is infection. And infection is a very critical aspect of sperm health as well. Okay? Contributes to infertility, that is, cause damaged or poor sperm health. Certain, not all infections, but certain infections can contribute to male infertility. How does infection contribute to poor sperm health? What happens is that the organisms implicated can either outrightly destroy the sperm cells, or they will impair the function of the reproductive system due to the immune response that goes on following their presence in the male reproductive system. This immune response are things like accumulation of immune cells, like the presence of radicals, free radicals in the system, and it can also trigger production of anti-sperm cell antibodies. So all these activities will lead to the destruction or the poor production of the sperm cells, or the organism can just outrightly eat up the sperm cells themselves, destroy the sperm, causes poor sperm health. Now, what are the kind of infections? Is it every kind of infection that can cause this? No. We have said these infections, when they are present, they will damage the germ cells, destroy the normal spermatogenic function of the testis or the male reproductive system. So what are the organisms themselves? Implicated organisms include chlamydia, so whatever species of chlamydia. We have gonorrhea, mycoplasma, Escherichia coli, which is commonly known as hepatitis, is also another organism that is implicated. Of course, HIV is HIV and AIDS. Mumps usually happens in children. It is a virus and it happens. Treat it, to handle it. Take the child to hospital, let medications be given, let that condition be handled as quickly as possible. Let it not linger in the body, because mumps, the organism, can damage testicular tissue and cause poor production of sperm cells in the future of that male child. So this is so important for parents, mothers to take note of. Then, of course, finally, tuberculosis. Tuberculosis is another organism, that is the Mycobacterium tuberculorum. That is the name of the organism. Tuberculosis as an ailment can damage the testis and cause poor production of sperm cells or outrightly poor sperm health. So prevention of infection is definitely better than cure. Definitely. If there is a way you can stay without getting the infection, please. But where there is infection already, early detection and treatment, especially these ones mentioned, can help prevent poor sperm health and, by extension, fertility. This is the end of